hard hearing. It's not only good that these ARVs are efficacious, but they need to be actually taken. If they work, someone has to swallow. And someone may not always swallow because he knows they work. Maybe they have different interpretation. So, if you are targeting the policymaker, it's not only good to bring out scientific facts. We are being told that there is the other aspect, the interpretation the users will put this. It also affects behavior change. So not only the scientific facts, but also the way people perceive, the perception of the people. In that immunization campaign, people were saying we want to sterilize their children. And they were convinced. I'm telling you, they were running away with the kids when we arrived. At one time we had even to involve the police to go and arrest. And imagine, this is supposed to be, it has been scientifically proved that it works. But someone is busy running away from it. So scientific facts are not only...
I think bringing in the police was also a problem.
Yes.
Well, let's emphasize that what they are, I think that what is
Yes, actually, the DHO were also put on task to achieve a certain percentage immunization. In my language, you have a saying that someone who takes you at night, you appreciate when the day breaks. You said, let's immunize them on force. Maybe when they see their children not following sick, they will appreciate us. I don't know, but it is straight here. It may have increased the negativity against the immunization. So,
what do you say about, there are people who believe scientists the way they are, because of fact, this is how what happened, this is true. Done like this is what happens. Then there's the role of the social scientists, which is then take up community issues and what we can see, how they then marry the facts. We have rolled out the facts, the truth, scientific truth. And then they see how they marry up with social dynamics in society, what we can see, how that truth can benefit that society.
They, us, should be we. Yeah. Yes, they, us, but if we, I think then that's how we can move. Okay, I think I'm told we earn a break, and then when we come after break, then we can see how to sum it up and maybe interact with you and also know her point of view about the difference between health system research and health services research. She has introduced that dimension. I would like to get vaccine and immunize herself, but for now we may mix the two. So don't get so irritated that you're mixing the two. You are ready to convert us. But for me, I'm almost there. Briefly she says, this is still to look at the bigger picture, at the macro level. At the moment you go to the micro, where services are being utilized, patient satisfaction, but say, that is the services. The number of things that can, a lot of debate can come out of that, and I would like to just the debate to remain within you until break. But there is that new dimension of thinking, and for some people it's not new, for others it's new. So Christian, for now, you're mixing them. Not to annoy you, but because that's the background. Okay. Just to summarize, no, had been left. So, we said we started that as a researcher, there is a problem in the community or in the system that you want to find a solution to. And the solution can't be found because you lack some data, some information. So you go out and make a research to get that information to answer the question. And this question, the way it is answered, will depend on the design you make. And it's important to be aware of the different designs so that you select the most appropriate that will answer your research question in the most convincing way. And we've seen the different way of thinking about knowledge, whether you think they are facts and you have to dig out on the facts and put them on the table, or no, they are no facts. You think they are no facts. Those things are social constructs. They just depend on perceptions. Or you think they are facts, but also they can take different interpretations by the different individuals. So that's where we are, and he asked for us, scientists, our role is to put facts on the table, and the behavioral scientists, social science, take it over from that. But for us, we produce facts. I interacted with someone who said, for me, I'm an epidemiologist. I only produce facts. And so that was the question, and this is more or less the suggestion to the question he posed. That if we are to be effective, we could combine people of different paradigms and then work together if we are really to make a change. We've seen only finding out scientifically that circumcision can reduce the spread of HIV is not good enough to control HIV. You need also to look at the other side. I think that's where somehow we ended. I don't know, is there any comment, question so far?
The reason we are not allowed Kiswahili in Uganda, we have started. The reason is it is somebody cheap.
Yeah.
Sometime back.
Lala chini, toa pesa.
Usually they are your water and usually cheap. Whenever the army came to war, they came with
Their computers are filled with certain facts, so to convince them to delete and replace, it takes some effort. It's a language of lala chini,
But that
toa
was
pesa,
25 years ago, and this is new generation.
baba iko wapi? Okay. So, as I said, again, there are so many unresolved issues in research, and we can't simply resolve them here. Neither is it really important to resolve them, leave them to academic debates. What is important is that if we select the right design, we shall answer the questions rightly in a convincing way. Whatever name we give to that, whatever category, may not be very, very important. So briefly, these are some of the possible categorizations. Some will say research is divided into two categories: intervention and non-intervention. But if you put each research, you either intervene, a researcher has something to do and observe the effects, or simply goes there to observe what is happening. So there is that kind of categorization, learning, confirming your theory. So other people will say research is either descriptive or analytical. That each research, you are either describing the situation as is, or you are trying to find out the connections between the different variables, different factors. Others will say it is either cross-sectional or longitudinal. You would go there and find out things at a particular point, or you follow things over a long period. And I say qualitative or quantitative. Either you go and find out new data, or you already get data from already collected, analyze that. So there are all those possible categorizations, and our students should not get confused into them and get bogged into these. It depends on someone's kind of thinking. And I know here we are more or less interested much in the. So these are some of the designs that you can use to do research. I don't know, is there anybody who is not comfortable with any or does not understand, or who has an opinion on any of these?
Wondering if it's possible to do an experimental study in health systems recently.
He's asking, is it possible to do an experimental study in a health systems research?
Yes.
Like an example.
Choose one of them. You saw them saying yes. Choose one of
It
them.
must be one idea, but they all went at the same time.
Someone said yes. Who did you say? See. Eric, you were saying yes.
Yes, it's possible. For example, in our country, we have we call health districts health zone. So we have a group of health zone who benefit from a special package of intervention. And in the same term, they are in the group. They are trying to make randomize in some of them, and they have control in another group of health zone who have not the same package, and they put their intervention, and they're trying to have the result, but they have studied all the system, all the integrated district system, so you have all this small block in system.
Maybe he would ask the package.
That's not like a cohort, kind of.
Because when you talk about coordinated intervention, they bring the package of what you have to do, and they follow it in time for 4 years.
suggesting.
Yes, yeah.
Another example,
Okay, yeah.
results-based financing. And I'm aware, for example, we already did an experimental study on RDF in a particular selected number of hospitals where they implemented the results-based financing and then compared with other hospitals that were where they did not implement that, and try to look at the system effect. I think what we need to understand when we talk about those systems research. Yesterday we were told that the system must have a geographical, so it could be at a facility level, and that becomes the system. So RDF in that respect was actually a health system to research.
Yeah. Of course, the challenge is to do pure experimental. Hence, they settle for the quasi-experimental because of the challenge of assigning randomly the study participants. And also, last study in northern Uganda, where in one of the areas is called the Acholi region, the private non-profit, we are being financed through research-based or performance-based financing. And then in the Lamusa region, we are being financed through budget financing. And then we are analyzing the various outputs and the outcomes. So these were the facilities really were not assigned at random. So it's kind of quasi, that's the difference between experimental and quasi-experimental. In quasi, you don't assign the study participants randomly, you don't assign them randomly. Yet in experimental, you have to assign them randomly. And he was trying to bring in the cohort. Someone can also just coordinate top of us, but differentiate between a cohort study and an experimental study. The voice over and there's some people haven't had thinking. Just the difference to be sure you're on the same. Okay. Oh.
To explain another quasi-experimental research that we are doing in PMDCT program. We are trying to study an approach that is called non-somatic approach. It means that newly HIV pregnant women or breastfeeding women who are newly diagnosed positive for HIV are getting support from peers, HIV women. It's kind of psychological support. And so we have randomized, we have two groups, two sides. In the first side, the non-somatic approach has been implemented. And in the other side, we have a classical approach where support is given only by healthcare providers. And at the end, we have to see if there any difference between the two groups.
Okay.
Is it clear?
Yes, it is. It is perfect. Your name is Richard. Sir Rich.
Like elevating maybe one of the.
Maybe they say you take it in Jesus' name.
Maybe you have to change the chair.
Okay. Are you convinced now that we can do experimental research in the systems research?
I think if you go to the sort of definition of experimental, yes, you can, but practically, I don't know whether in the end you would call it experimental.
What may prevent you from calling it experimental?
Because a lot of times when there's diffusion, the practicalities of it, you say, I'm getting this straight, you get those differences and so on, about this control. when it's truly comparable. So I think you can set out trying to design that. But
Yeah.
in practice, when you get down to it, it's not
Yeah,
quite
confounding. Yeah,
so much
Yeah,
that
it is.
there are issues.
Yeah, you can question that, but I know the statisticians are trying to develop models to control confounding factors.
Which then removes the very context that we desire.
It doesn't. But as per the definition, it's experimental.
Yeah.
Whether now you're questioning whether the results from experimental research, system research, are acceptable or not, are valid or not, are they dependable, are they now? That's the question. I think the first one is possible. But indirectly, whether the results are reliable. And that's the difference.
These are a longitudinal study. So you follow people over time. But there is no, you are not responsible for the intervention. So you don't put intervention, you just observe these people in time.
Yeah.
So we can have one group or more group as well. In the beginning they have not the problem, and at the end it must go. So you check without exposure.
Yeah. So in experimental, it's the researcher who introduces the factor that is you think can cause change. In cohort, the researcher is not responsible for introducing. The researcher is responsible for causing change. He just observes the different groups over time. Then times case control, so at times can also confuse students with the cohort. Can someone also briefly say what a case control is? You can compare it, what I understand by case control.
So in a case control, I think that key feature is we will begin with the outcome of the discussion. So if, for example, you want to see the factors for occurrence of a certain disease, so you get two different groups of people. One group has the disease and then the other one does not have. And then now we do kind of retrospective. See factors who have been exposed to that can explain the occurrence of that event. So prepare that man.
Yes. And it should be everybody's understanding because that's what it is. Yeah, because someone already has the condition by investigating, and you're trying to get those who have that condition and match them with a group that does not have similar characteristics, and find out whether you are exposed a certain factor that you think is responsible for bringing up about this condition. Anybody can say the difference between exploratory and the descriptive? A cohort can be done prospectively or retrospectively, going backwards. And actually that is the real conclusion. Who can just try to break it down that to manageable understanding. Epidemiologist. This should be your piece of.
I didn't say the question.
What is the difference between a retrospective cohort and a prospective cohort? Okay, now you are bringing three. So now already we know the difference between cross control according to you and the prospective. Now he wants to know the difference between the case control and the prospective cohort.
In case control studies, the starting point is those with outcome or cases and those without outcome or controls. And the next, there will be assessment of the exposure status in both cases and controls. And retrospective cohort, we review registration or request for past history of exposure and subsequent development of outcome. That is the starting point in retrospective cohort. The exposure status is the past, and then the subsequent development of outcome, both in export and non-export. So the design is different.
Okay. The way you look, you are still digesting it. It has not yet come to conclusion. But if I may also put in other words, if we can give an example, commonly given is lung cancer. It's commonly lung cancer versus smoking. So, if you were to do a case control, you ask people who have lung cancer. You start from people who have lung cancer. And again, matching people who do not have lung cancer. And from each group, you ask, do you smoke, do you smoke, do you smoke? Even the other group, you ask, do you smoke, do you smoke, do you smoke? And then you conclude, is there more smoking in those who smoke? I mean, more cancer in those who smoke or not? So you start, as it says, a case. And because it started from the disease point of view, the case is already a disease person. Then, if you want to do cohort, now you start from exposure. And only you invite people who have smokers. Those smokers, please register here. We are doing a retrospective cohort. And then you ask, do you have lung cancer? Do you have lung cancer? Or you investigate for lung cancers for those who are exposed. So as said, the starting point in a cohort is the exposure. The starting point in a case is someone already with a condition. You can do retrospectively, you say, have you ever smoked? Prospectively, are you a smoker? Is it clear now? So, exploratory is just a short one. You want to find out what's the nature of the problem. So, really it is descriptive in nature, but it is on a very small scale. Yet descriptive one usually are on a bigger scale. You try to find out the details. So I saw there is a lot of interest in trying to group different designs into whether they are qualitative or quantitative. But as we know, whether quantitative or qualitative is not a design but a method. But as I said, those are debates. But at least we know that you can either do research using qualitative or quantitative. And from our previous discussions, we can somehow say which designs use more qualitative than quantitative. In many of the researches, our students will undertake. It will be, I usually advise them not to say this was a quantitative. I would like them always to add maybe mainly or largely or maybe something like that, because as we have seen, it's very, very difficult to have a purely quantitative and then purely qualitative in health systems. Okay, what's what are the advantages of using a qualitative approach to research? Why should someone use a qualitative approach?
You use this system so that you can gain how that person perceives the scenario.
So you want to get individual feelings and perceptions about an issue, and that's difficult to quantify. Can't you quantify? As I say, the number of these are feeling this way, the number like this are feeling this way.
Well, that's why you did say that it is very hard to have a qualitative study, because at the end of the day, you will have who say that the point of service was good, and this is the description of the point of service that they gave. If the majority say that this is how we perceive the service, then you at the end of the day say a number of these have said this, but you will definitely, every person will give the true description of satisfaction in the same way. So it is always very hard to measure that these people they have been satisfied in this and this part.
Okay. Then addition as to the importance of qualitative research. Yes, sir. Good to have from epidemiologist now. Is becoming a relativism.
They can use that as starting points to develop quantitative methods. That is based on the quantitative findings. You can prepare quantitative methods. For instance, if we know what problems exist through focus group discussion, then we can quantify the magnitude of each problem, and that's it.
Yeah, it's true that qualitative research can be a precursor to the quantitative. Most of the time they come late, or they don't treat us well. So you may now want to go and say how frequently really do they really not come late. So there you observe them and say actually what they say that is either true or it's a one so, and the people concluded from that. So it's true that you can use qualitative research to generate what they call the hypothesis. And so through qualitative research you can generate the ideas, some reasons, insights to the operations in Rwanda, these are the operations in Uganda. So if you have to understand the context, qualitative research is very, very important if you select your respondents very well. You want to add to what you have done?
There is also some opinions about phenomena. We have also sensitive method. With sensitive method, we can also classify people. When you ask him a sensitive question, you will ask him, he say just yes. But if you use qualitative, you can have more information about why these things.
Yeah, it's somehow I think you were saying qualitative methods give you a chance to grow, and they ask you the same question in different ways so that you get the reality. Otherwise, it's a quantitative research, and they say if people they give you what they think you want, you do a self-administered questionnaire so that you don't influence what they answer. But so also through qualitative research, you are given the opportunity. The main thing is that qualitative research is you don't have too many respondents. You have few and you have more time with them, so it gives you a chance to understand the depth of the matter. There's a series on Al Jazeera about they call it Desperate Journeys. Have you seen that? Desperate Journeys. Come on news. Scientists do not watch news. What do you watch? Soaps.
Al Jazeera.
Oh, you don't watch Al Jazeera? That's a good one. But it's about people who are put in boats from developing countries trying to cross into the developed countries. And usually it's done by smugglers. You pay them some money. They say if you pay me, I will make sure you reach Italy from Libya. And there are so many actually. So if you want to understand really how do these people make it, what is the journey, it's very difficult now to ask everybody or to ask so many. So what they did, they got one of them, and she said, I paid the smuggler when I was in Libya, but then I was arrested in Libya, and then I paid and escaped. Then we went to another one who put us in a ship, and then when we are about to arrive, then the operator of the ship simply disappeared, and we were floating, and now I'm here. They were rescued when they arrived, and then she's hoping to reach, I think, Sweden, where her cousin is. So, you see, it gives you an insight now. Interviewing one person gives you an insight on the life of a smuggled person, which is difficult to get from a quantitative interview. But I don't know, the journalists, should we say they are just right? At times, they are here in Kampala, I say now they are coming elections. This is what Ugandans are saying about the elections. And he interviews two people. They represent Ugandans. Would you take that result or not? That this is what the Ugandans are saying about the elections. Those two people. Why don't you take?
That's not the fact. That's the opinions of people.
I say one of the targets of this course is what? Journalists, not so. They should also the state of health care services in Uganda.
I think when you talk about research and you will first know how the response is it by a conducive way where these are the easy people to reach. So yes, sometimes when they bring those so-called opinion polls and what, they could describe how they selected the respondents, and you find the respondents is representative. Then I could say it's research, but if they just meet one who is honest and brings his opinion, it's not research. It is an opinion of political analysis.
So how do you select respondents in qualitative research? Yes? Purpose. So had they said it was purposive?
But representative, that is another question I will ask.
Okay. Representative.
Yes, purpose is one of the reasons, but still,
It has to be, the purpose has to be clear. What is the purpose that you selected this one? Is it a representative? So those are the opinions, and some people right away they will dispel the qualitative research and say, what is the power of this? Were the respondents selected randomly and so on? And they usually that has an implication on whether the results are accepted or not. Yes.
I think that is something we also had a discussion about yesterday in terms of the difference between what we call health systems research issues versus other studies, epidemiologic research. And we talked about the concept of, for example, samples. And we said, when you look at, and we have had problems for us as a department where many of our students who are majoring in a track called health systems face when they go to IRB. Because they find people who are used to this Isha Grizzly or whatever, and then there is a 382 somewhere, some magic number there. and then these ones, they go with their narratives, and then they ask, where is the sample size? How sampling procedure? I mean, the point I'm saying is, we seem to understand that you can come on with a particular case. You can actually study one case, agent 0, start them from there. But I think the difference comes in the way you make the conclusion. Because if you are studying one agent, definitely you will get good information about a particular problem. But if you are going to conclude and say, majority are saying this, or Ugandans are saying this, then I think that's where we should focus more. We can only make conclusions based on the person or the people who were interviewed, but not make the generic sort of statements.
Yeah, I think, and the main point is embedded how this respondent, this case actually was selected. We say this is, if we want to study the state of hospitals in Uganda, a case study, we should select a representative hospital. It is debatable what is representative and so on, and it's very difficult to find a hospital that will represent every characteristic. And what Christopher is saying, when you are concluding, state, this is very state what you did and then what you are concluding about. So if you want to conclude about health services in Uganda through a case study, provide proof that this is a true representative of the hospital in Uganda. It can be through a consultation, and they say, when I consulted, they said this is a representative. But it has to be clear. And usually you see big headings of articles and so on, the state of healthcare services, and someone went to one health facility and say, you see, this is the case study. You see, this is a qualitative study. Qualitative study has also to be scientific. Yeah.
Mine is just a comment or an observation.
Yeah.
We are going to be TOTs. And I think the message here now, I'm trying to add to what Crispus has just said. You can use either or both. But or if you decided to use qualitative, or whichever you chose, he talked of the sample size like in quantitative, where there are formulas that are stipulated. You can use. There are many formulas that you know we are not actually using.
The quiche and
easily. But there are many other formulas. But even in the qualitative, I know you can justify why you have chosen a particular number of interviews, whether key informant interviews, whether focus group discussions. And I think that's where at times we don't emphasize, we don't guide our people, that if you have to use this one, you should look at A, B, C, D. And if you have chosen 8 interviews, they'll ask you why 8. Why have you chosen 8? You should be able, as a student, to justify why you have chosen either 10 key informant interviews or 10 focus group discussions and things like that. Because that is like the sample size. It is the question they're asking the other side. And I'm sure if you answered that one, no one will castigate for using one method.
Yeah, I think it's very, very key. Qualitative research has a sample size. There are a number, just showing the number. But I think the question should not be how did you calculate. At times that fixes the students into thinking that actually all sample sizes have to be put into a particular, going through a particular formula. But how did you come up with that sample size? I think we can't hide anywhere. Say, you see, this is qualitative. I just thought of 8. There. So, what are the different factors, guiding principles that can help us to get to a particular sample size in a qualitative research?
Number of ahead, or number of interviews, or focus group discussions, and qualitative research is generally guided by elements of saturation. You feel like you're going to reach saturation from your informants. And there are ways of determining, and the literature guides fairly well in terms of what makes sense in terms of focus groups and in terms of interviews. But I want to push a little bit on this one method dominates aspect, because I think the unique thing about health systems research is the mixed methods approach. And that's also the struggle that IRBs have with health systems research, is generally a leaning on either quantitative or qualitative. When in general, when you're doing health systems research, you are using these methods where you're complementing one method with another, supplementing one with another, or utilizing new methods that IRBs aren't familiar with, like social network analysis and things like that. And so the one method dominates, I'm wondering if we can challenge that a little bit as being the challenge of health systems research.
Actually, it may dominate. It's not a must. It's not a must. It's challenging, as you said, that one method always dominates. It's true, it's not always.
I think it's a struggle for health systems researchers.
Yeah. It's not always. And many times we find students try even when they do qualitative research. Times you find them struggling to group the respondents, and they're also trying. I think it will be discussed in the next session really how to analyze the qualitative research, a mixed research. Because at times you find the interviews students get from the qualitative research trying to be grouped and they combined in numbers with the quantitative research. I found that challenge with the many students, that they fail to see how to interpret the quantitative data in combination with the qualitative one. And at times the leaning is always to make almost everything quantitative. And I think the teachers really have a very
Can I
good
give
job.
an example? According to the study, about what I've said, we are a mixed method, qualitative and quantitative. In the quantitative component, we are all HIV positive pregnant women attending the NC services during 1 year in about 16 facilities. But in the qualitative part, we are looking for the perception of healthcare workers about the fact that these women are taking a lifelong treatment for the HIV infection. And but in the quantitative component, we are taking in account all HIV pregnant. So at the end, I think that we are expecting to have almost 20 women in the
Health worker, for example, to interview at a health facility.
It depends on how can I say.
Availability.
Yes.
Okay. That's a kind of activity. I don't know, you should, again, I think you need to define the boundaries, that if we don't find a health work of this category, we don't interview anybody. You should, as I said, I think the sample needs to be representative enough. So not any, unless you think that the issues...
I agree with you, but oh my English, I'm sorry.
Yeah, but it's okay.
Availability, but also it depends on years of experiences.
Okay, yes, then
Yes, we have
you are
to
bringing
join
in...
these
Yes.
parts all together. And we have said that if the healthcare facility worker is not able to give us deep information, we can just stop and go to interview another one, but in the same facility.
Okay. Any further comments about qualitative, quantitative methods mixed? As I said, depending on mainly where we started from, usually we can be biased in either of the two. You find someone only believing in qualitative, find another one only believing in quantitative. But we've seen that numbers per se are not good enough evidence to make a policy decision if we don't bring in the perceptions and understanding
In my view, I think it depends on the research question. So you see the research question, now depending on the research question, you decide the most appropriate method to answer the research question. Then you can use the other method to kind of supplement that. That's why I say so. What I've been trying to process in my head is how do you bring the two to equally answer one research question? I find it difficult to do that. And so we are saying in health systems, we need to use the two to answer one research question. At the same level, that's where I'm finding problems. So I would want to call it bias. If you're, for example, studying attitudes, certainly the best would be qualitative. Perceptions are the best qualitative. But if I want to see the risk factors affecting utilization of certain things, maybe I want to first go quantitative, but also do a little bit of qualitative to supplement that. So it's a discussion, but I still seem to agree with that statement. And I usually tell students, I think the thing of saying both quantitative and qualitative,
it's not
because the objectives are mainly answered using quantitative. They are going to do regression analysis, etc. Then they are saying it is both quantitative and qualitative. I think the better say it is quantitative, but you use quantitative methods to supplement. Because what happens if there's a possibility that the two can disagree. Quantitative is saying this, but when you interview individuals in detail, they are giving you a different reason. So does it mean the question is not going to be answered? They're just thinking aloud.
It's very interesting. But
That's the importance of triangulation, though. That's the importance of triangulation.
So he's saying if quantitative differs from the qualitative, does he have an answer from the question or different methods of triangulation so that you are not caught in that fix? And I said it's not also good to have only one respondent in the qualitative, or you need select the respondents in the qualitative that will represent. If you think there are varying views among different groups, then you have representatives from each of the groups of interest. But I don't know what other think. That is true also for me what I've been telling students, which also can be challenged as no one has one answer. I usually say, don't say this is qualitative or quantitative. I prefer them inserting a word largely so that when I find, you said you like the quantitative, when I find the qualitative information, I'm not. But in the detailed methodology, someone should state which data variables they are going to address quantitatively and which ones are going to be addressed qualitatively, and whether it's triangulation or it's totally different variables. But I think it's also I'm uncomfortable when it says it's both quantitative and qualitative. Almost every research is. It doesn't show that someone really has understood the two. Professor.
I just wanted also to share my comment. I have been brought as quantitative. I'm a believer of qualitative. I mean, look at health systems. From the introduction yesterday, we all agreed that it's complex. So when addressing a problem or issues that are complex, you would find that qualitative has an upper edge compared to quantitative. You don't answer questions that depends on context with a question of yes and no, which quantitative is mostly inclined to. So on my side, I normally would advise students, especially if they want to explore and get a true meaning or true answers to what exactly are the issues there, to do qualitative. And then quantitative comes in to quantify. The limitation of qualitative is that it's not representative. The advantage of it gives you perspectives. So some of the perspectives are shared by majority, while some of the perspective belongs to few entities. But you need to exhume all of that because you don't know which is which. So at the end of the day, when you quantify, then you know which perspectives are shared by most, and that would guide you to intervention. That's my feeling.
Yeah. And
If I can summarize, I would say that the qualitative method is very interesting for a new phenomenon. When a new phenomenon is occurring in, for example, in the health system, I think that qualitative approach would be very good to make a first study to better understand the new phenomena, and then we can quantify later with quantitative methods.
Okay. Would you say that is the only use?
Not the only, but another importance of
okay. Okay. So if I may ask, given all the discussions and the comments, are there researches that are purely qualitative, any that you think we need purely quantitative and another one does purely qualitative?
Certain situation, observe and kind of write note before the finding of this is how it is. To me, it would be of no use to say this number of people, this percentage of people think like this and this think like this. Because remember, it is a cultural setting in a way. You are observing what people are doing. So it would be better for you to report and say, this is how they do it, than trying to justify that 80% of the population here think this way. Because remember, if there is a possible behavioral thing, the law must be tending towards the same behavior in that setting. So, in a way, ethnography studies are pure qualitative.
I wanted to say maybe you rephrase your question because you said that there are those who wish to
So you want to set a different question and answer it?
Or you say that there's those pure qualitative.
Yes, I'm looking at the students we are going to guide. And I see a risk of us being saying that, well, every research must be either mixed. I have to see some quantitative and qualitative. So that's the challenge. So what I wanted to say is that at times you may find a student may find at times because they are limited in terms of time and in terms of resources they have to carry out research. So we if they say that each research has to have both, needs to have both a quantitative and qualitative, they may be limited. But I think one way we found that maybe someone needs a quantitative research and they want to investigate the issues of the quantitative research through doing a qualitative one, or vice versa. So, at times researchers, they do one of the two because the other has already been done and they want to triangulate what has already been found. Or they can split and say, you do this part, I do this one. Because we've seen that the design can be actually dictated upon you, either by the institution where you want, the journal you want to publish, or by the agency that is giving the funds. So it's important to look out when because getting a research topic is one of the challenges for students. So we can take them and say, if you find a research that has already been done quantitatively, you can translate by doing a qualitative one, and vice versa. I think that can be one of the guidance that we can give the students. Any other comments, questions?
Literature out there which trying to explain if you want to mix method what you should do. For example, I know there's a book by Criswell which is talking about mixed method. Look at how do you mix these two. So now I think that we tackle the question of advantage whether it's qualitative or largely, but it's all both. Quantitative and qualitative. Actually, in that book, they also talk about you can do both parallel.
Yes.
It depends on the time and resource you're having, and then improve. So, to me, I think the research question should be the key.
Yeah, I don't think we are saying the different things. Maybe you are saying it in totality, starting from the question. But as I said, my point was that at times the students, as we know, may not have the time and resources to do each effectively or answer the question both using both methods. So I think it is when they can look out for questions maybe that have been answered on a quantitative side, but they haven't been triangulated qualitatively. That's a practical thing, what we have seen. Unless it depends also on the students. At times students do research for the sake of practicing such methodology. So they sit in their class and formulate the research questions, not really intending to impact on policy. But if we intend the research is intended to impact on policy, you may, I don't know whether it's wrong to find a question that has quantitative answers but has no quantitative answers, or vice versa. I don't know whether that is not possible.
No, it's possible because a quantitative but also you have an embedded quantitative in it. You can also have a qualitative but also have an embedded quantitative in it, or you can have both. So it's possible.
My question is must we, can I, based on already done research, maybe which was largely quantitative, answering a certain question, but also contribute towards answering the same question but using qualitative. That is my review, because I usually interface with their limited times of time and times of resources available. That's not it's a practical.
Study which has already been done, maybe a report is written or published, that is mainly quantitative. So you get a quantitative results in that study, and then you generate some qualitative findings to try to work it out. Well, I don't know what others say, but I find a bit of difficulties, and I also think it depends on the study design. Because, for example, if it's cross-sectional, so here you get a study which was done like about a year ago, and then now you come and do qualitative data collection, you find that the things have been overtaken. Yeah, has been overtaken. So I think we have to think about it.
Issues expire within, are they overtaken by events?
Well, that's why I say it depends. Depends, yeah.
But you concluded I wouldn't go for it.
That actually there could be cases where one design could be formed the other. So you sort of sequence your inquiry, that you have a quantitative research that you do, and then you want to use that quantitative research findings to try and generate new questions that then you go with the field qualitatively to try and there are possibilities that you can decide where you want to start. Start with qualitative, and then you find a couple of hypothetical questions that require testing quantitative. And I think that's also another way
I think this has been a really interesting discussion if everyone is thinking about how they're going to teach this. And I think the types of, what would be interesting to include in this module is the types of questions that are health systems research that have a more quantitative leaning, those that have a more qualitative leaning, and those that would require mixed methods research. I think that would help anyone that's delivering this course to be able to respond to students that have these kind of questions and have these kind of debates is what questions are health systems related, health systems research questions, but require more of a quantitative design or approach, or qualitative design or approach, and those that might be more mixed methods. Because I think this kind of discussion obviously will come up with each of you as you're with your students, whether they're policymakers or other PhD students. And to have that handy would be helpful, I think.
Do some group discussions, but since the time is not there, maybe we can. But it seems you did not go that far, each one to formulate a research question, and you would comment whether it requires a qualitative or quantitative or a mixed. The ones I have, they are few, but maybe we can
pick qualitative findings from another study, and then you decide to put a qualitative. What would that be answering? Just try to look at the rationale.
As I said, the question is the same. The justification would be triangulation.
Because it looks like quantitatively the question is already answered. Just try to think about why would I give the real answer if I said why don't I answer it quantitatively?
As we said, the quantitative, for example, you have already found that when you circumcised, circumcision reduced HIV spread by 65%. So to tell the policymaker that make circumcision policy not be good enough if you don't know how people will look at it, how people will interpret it. As he said, maybe that's the challenge we've been faced, that for us science, ours is to put facts on the table, and then the behavioral scientists, they see how to market it to the what? To the population. So that would be, say, but what affects the uptake of circumcision in the community? And maybe that may be a qualitative.
You cannot just transplant a question that was done quantitatively and then try it.
To answer it, yes.
The triangulation component, I think, emerges from what you find results. And you seem not to, you want to exactly understand why such results are emerging. Then you formulate questions about those particular points of results. You try and go and get context and explanations to those. So, for example, using the example, if you find that male medical circumcision reduces HIV transmission by 65%, then the question definitely will have to be different when you go quantitative.
Okay.
What kind of questions does a quantitative approach answer, and what kind of questions does a qualitative approach answer? And the what questions versus the why questions. You may not be able, and I think this was from what you're saying is, you wouldn't answer the same what question with a why approach.
Yeah, I think
from a qualitative approach, you might not know that HIV is reduced by 65% by circumcision. You wouldn't get that in a qualitative way. You'd have to do that quantitatively.
Okay, so if I want to answer that, does HIV, is that, does that require a quantitative, qualitative, or mixed design?
Requires a mixed design, you know why? Because the way of approaching that question from a health system perspective is to look at the entire bit. We sort of focused on service delivery, and then there's the population acceptance of the intervention, the effectiveness of the intervention and so on. But there's another bit where I would ask, so what happens to the foreskin? You need to dispose of it. So does it cause environmental problems if you have to buy incinerators? Because now you have a heap of foreskins in the place because the intervention is successful. And one thing that we used to say, which is see a fire every day in the place. So we have to look at the medical devices as well and say all these have to come in, and that investment is required for you to make the whole intervention successful. It's not just about training the surgeon and implementation and so on. You have to look at the full integration. Do you need more electricity? Do you need whatever? So the kind of questions you want to ask require mixed method.
Yeah, of course, I see now, I think the point people are trying to make is that when you go into the exposure of foreskins and so on, that now you are answering a different question.
But again, I think the issue is when do you mix this method? I answer it's a question I think if you do, for example, you are quantitative and then you calculate what was ratio and everything, and then you come after 2 years, you do your quantitative and then you call that mixed. I don't think that's so I think when you mix, I think because if you come 3 years, that means some of the people maybe have shifted, some of the people are dead. So, and then you cannot conclude that based on the quantitative result, and then this is my quantitative, is not supporting the previous quantitative. So I think the issue is when do you mix?
So the basic question, that's the basic question. We want to answer that question.
Yes.
at that particular time. What method do we use? Is it a quantitative method or a qualitative method to answer?
Everyone should have an opinion as per now. If they are the advisors to their ministries of health who are going to fund research on whether circumcision will reduce the HIV transmission here.
What study design will I
be the idea of another? Don't everyone will not think the same. Yeah.
I think much as we know health systems have these methods, again I'll say depends on the question. I think this particular question, look at HIV transmission. I think it's really based on the science. It's based on the science. If you look at circumcision and HIV transmission, it's really science. And I think the issues of opinions, if we go qualitative, we're bringing opinions to explain whether it actually prevents or not. So I think I would go for quantitative studies as to whether it's going to be randomized and OPC. But at the end of the day,
One to have intervention, possibly also looking at the pathway. So why am I introducing now is actually to see if that intervention will be sustained. If I ask someone how people being circumcised, and the answer is yes, and how did you get the knowledge of being circumcised? That's a follow-up question, which is hypothetical. So that in my conclusion, I would know that this particular intervention will have a sustainable effect because of the protective part of that person's perception. Okay.
And this is how usually debates are. And the decision is to be made whether to fund the research.
Yeah, maybe if I may start with some correction, that qualitative and quantitative both are sciences. And that's why we apply them as research methods to get facts. So it depends on the nature of facts that you are looking for. Some of them you can get best through quantitative methods, and some you can get best through qualitative. So both are sciences. Now, to answer that question, I would go back to the point I gave to Crispus. There is the issue of efficacy and effectiveness. Is circumcision efficacious in reducing HIV transmission? That, to me, is quantitative. It can be done in Kenya, and the findings can be used in India. But when we come to effectiveness, and that's where now the qualitative issues come in, that yes, in India, circumcision reduced HIV by 60%. The first question will be, will it reduce by the same magnitude in Tanzania? It's not necessarily true that it will be 60%, because the context now differs. And when we get into the context, that's when now we want the qualitative. That's my opinion.
So I think we can summarize. I don't know, was there another opinion?
Trying to think about one, the question, and therefore the design, but also thinking about the question and where the study falls. For example, if you look at just the having circumcision and HIV transmission, if you are coming from an HSR perspective, you are really interested in asking, what is the HSR in this? Or what is the epidemiology in this? And my theory is once you sort of understand those perspectives, then you begin to approach the design, the analysis along those lines. So I think for me the challenge is really try to get that question and reflect on which area of research that particular question might need to be addressed.
And when you talk of area,
so I'm talking about, for purposes of this discussion, calling Galorian being health systems research or epidemiologic research.